Good morning, everyone. For those that don't know me, my name is Simonne Maline, and I work at the Consumer Counsel System of Maine. And this morning I wanted to review a new bill that has been released by the Revisor's Office at the Maine State Legislature. And I've heard some feedback that it can be a bit challenging to understand what the bill is. So I'm going to do this quick video and kind of walk people through the bill. Now, it hasn't been scheduled for a public hearing yet, so stay tuned for more information on that front. I'm going to share my screen now and bring up the bill. The number of the bill is LD 1586, an act to strengthen statewide mental health, peer support, crisis intervention, mobile response, and crisis stabilization unit services to allow E911 to dispatch using the crisis system. Now that's a mouthful, and I can understand why this could be potentially confusing. I will say, for those of you that followed the mental health working group that came out of the legislature a couple of years ago, that myself and other peers and advocates and providers and law enforcement, a whole bunch of folks, including lawmakers, worked on. This was one of the recommendations that came out of that work around Maine's crisis system. So scrolling down, so Part A talks about, so this is separated into different parts, so I'm going to review each part. Part A really talks, and I'm going to use, if you can see my mouse, I'm going to highlight some things. This really works to provide additional funds for the statewide crisis line and state warm lines. We only have one in Maine, so it would really be a warm line. And this also provides training and workforce development for peer support specialists who provide services through crisis lines and warm lines. So this particular bill would work on workforce development and peer support. The actual amount saying that's going to need to accomplish that is $45,469. I'm not so focused on the money piece, even though I'll point it out, and I just want people to understand how this could potentially impact Maine's crisis system, including adding peer support and recovery coaches to parts of the system. So we're going to move on to Part B. And so Part B is focusing on mobile crisis support. So that's when a crisis worker would come to your home or meet you at an emergency room or in another location. So there's lots of language here, but I want to go into the subsections down here because they kind of spell out what this would look like. So this talks about, this particular section talks about strengthening mobile response, and adds peer support specialists on mobile crisis services. And the estimate is $808,000 to do that across the state. So that's what this particular little subsection talks about. The next one here, this initiative is to strengthen, sorry, I'm reading at the same time, puts certified peer support specialists and recovery coaches into mobile. I don't know why they differentiated them, but they're here for more at $406,000 out of general fund money. And general fund money is not main care. It's money that the legislature appropriates, and that's called general fund dollars. The next section here talks about adding mental health social workers into law enforcement. and creates liaisons, which exist in a few places in Maine, but this would further expand their availability to have mental health law enforcement officer liaisons. And that amount is $554,000. This next section talks about additional funds for critical incident response services and community debriefing. So when there's natural disaster or big events that especially first responders use to community debriefing and critical incident response. So that's what this particular section is. It's $113,674. And then this next section, and sometimes the top few sentences don't really explain what this is about. So this next section is talking about for co-locating, and there's not really a different, I don't know, the difference is not really clear around mental health liaison positions. This would put funding for mental health law enforcement mental health liaisons to be co-located in law enforcement agencies. So it's a little bit different than the two above that just say law enforcement liaisons. This co-locates them in with 911 dispatchers, and that's $470,000. Now we're going to move on to page 3, and this talks about this section talks about adding funding for ancillary services. So in my mind, ancillary services may be your billing code specialists, your admin staff, those kinds of folks needed to help support the infrastructure of crisis providers. That's at $636,575 here. So this whole section is see how it says ancillary services for mobile crisis. Then if you go down, so all of those sections above total $2,990,081. And we're not done yet. Part C moves into crisis stabilization units. And those are places where you can go for short term. It's like it's a level where before inpatient. So crisis providers often have what are called CSUs or crisis stabilization units as a residential alternative. And in this particular section, it talks about adding certified intentional peer support specialists and recovery coaches as part of crisis stabilization units. That would start October 1st, 2021. And so here's the portion that talks about the funding for peer support and recovery coaches in CSUs. That's $1,265,753 for that piece. So now this section is really talking about residential crisis services. And then section D1 is around a public communication plan and outreach. So this would be ads and new newspapers and all kinds of things to really tell people out in the community what's going on with Maine's crisis system. So this $100,000 is really to really look at getting the information out about changes to the crisis service system. And this is just the bill summary, which talks about all those different paragraphs in sections that I just reviewed. I hope this is a little bit more helpful than reading the bill document. And if you have further questions, please do not hesitate calling the council office, 207-430-8300, or check our website. We're going to have more information on it. But I did this quick video to kind of go through what the document explains, because it can easily be confusing. Thank you. Have a great day.